So this is rescue breathing. This is a case where I've checked for signs of life. They're not breathing, but they have a pulse. Make sure when you check for a pulse that you use the pad of 2 fingers, not your thumb. Your thumb has a pulse in it and you'd feel your own. This is your most basic breathing barrier. It's not the best, but at least it provides you some protection against bloodborne pathogens. So I want to put that on. Now, when I give rescue breaths, I'm going to pinch the nose and I'm going to make a seal with my mouth around theirs. I don't want any of the edges out because the airflow is going to go to the path of least resistance. So if I don't make a good seal, it's going to leak out there. If I don't pinch the nose, the air is going to come out the nose instead of going into the lungs. So I put my breathing barrier on. And don't get frustrated with this. If you come in and try it out and you're having a hard time, just make sure there's no mechanical issues, and that the key here is making sure that you do the head tilt chin lift right. If you pull back too far, it puts tension in that lung. It'll cut the airway off. If you don't pull back far enough, it cuts the airway off. There's a little right-angled edge in here that will cut the airway off. So pull back about 1.5 inches, 2 inches, pinch the nose, open the mouth, and then give your breath. And it should last for about 1 second. Notice how I'm looking down to the body and you saw it rise. And you'll hear the air go in and expire. So I want to avoid gastric distension. So if I'm much larger than that victim, as soon as I see the chest go all the way up and kind of stop, that's when I'm going to stop. I'm not going to continue to try to enter air into the lungs because I don't want it to overflow from the lungs and go into the stomach and then cause them to vomit. 1 breath every 3 seconds. Notice how I'm staying down here close. So you go 1 1,000, 2 1,000, breath. 1 1,000, 2 1,000, 1 1,000, 2 1,000, 1 1,000, 2 1,000. So I'm breathing on the third one. And notice how I'm not raising up each time. Because if you start giving a lot of rescue breaths and you start raising up each time, you're going to get lightheaded and pass out. So stay down here close to the victim, 1 breath every 3 seconds, and watch the chest rise and let that air expire. And just continue that. The smaller the victim is, the less air, especially if I'm much larger than them, that they're going to require. And I want to avoid gastric distension. See if you can do this for 1 minute. So time yourself and do 1 breath every 3 seconds for a minute.